I am Al Mazak, State President of AARP Wisconsin, and I want to continue today bringing you the facts about the healthcare discussion that is taking place in Washington, D.C. and around our country, including our own state of Wisconsin. As I said last week, I have been traveling around the state with our staff and volunteers from all over our state during the months of July and August. We've been talking about the healthcare debate and listening to our members' concerns and stories and questions. One thing that we have heard consistently in one way or another is that people are tired of the usual political games and they're looking for solutions to our healthcare crisis. They want healthcare reform that will give the freedom of choice, and they want reform that will stop the companies, the insurance companies, from denying coverage because of pre-existing conditions or denying coverage because of age. Today, I want to talk about two more questions that we have been hearing. Questions that I have said arise from distorted or untrue information that is being spread. The first question is usually something like this. Is it true that seniors will be paying for Medicare and healthcare reform through Medicare cuts? Will healthcare reform be paid, in other words, on the backs of seniors through Medicare cuts? That is absolutely not true. House Bill 3200 does not cut benefits or increase your out-of-pocket expenses, period. The traditional Medicare program will not be used to keep other healthcare improvements affordable. It is just not true. Let me be a little more specific. The House bill includes a number of important priorities that AARP is fighting for that would strengthen Medicare. Preserving access to your doctors and hospitals, the doctors and hospitals that you choose, and assuring that your doctors will be paid fairly by Medicare. The proposed bill will also close Part D, that infamous part of the prescription drug program, often known as the donut hole. It will help to close that hole and preserve and improve your benefits and eliminate some of the cost sharing that comes out of your pocket. It also includes several provisions that will get rid of waste, fraud, and abuse, that will take those things out of the Medicare system and will save perhaps billions of dollars. It will create new payment incentives to encourage our doctors and our hospitals to improve the quality of care and to provide for it more efficiently. AARP supports efforts to reduce waste, to reduce fraud and abuse and inefficiencies, and to improve the quality of care in Medicare. For example, AARP is fighting and supports efforts to weed out and penalize providers who engage in faulty billing practices, such as fly-by-night companies that create sham businesses and false Medicare claims. We support the elimination of overpayments to insurance companies that provide substandard quality of care. And we support the elimination of waste in Medicare through better transition care that would help avoid costly, dangerous, preventable rehospitalizations after a person is discharged. The fact that people end up in the hospital in less than 30 days after they are released after treatment is costing the system billions of dollars, and with some simple follow-up care that can be changed. Now to the next question. I like my doctor. Will I have to change? Well, no. Reform will help preserve access to your doctors, to my doctors. The legislation will prevent an unwarranted 20% cut in Medicare payments to doctors that would otherwise threaten access to your doctors. It also will increase pay to primary care physicians and geriatricians. It promotes training for more primary care physicians and nurses so that we have enough healthcare providers to treat everyone. AARP simply would not support a healthcare reform that would deny you the ability to choose your own doctor and your health plan and your hospital. Thank you again for giving me the opportunity to talk about this important matter, and rest assured that AARP is working for a uniquely American solution which will guarantee you and your doctor will make the healthcare decisions rather than some insurance company's CEO. With reform, healthcare will be affordable, benefits will be stronger, and premiums will be less. Next week I'll address 2 other questions. Have a good week.